Good evening and welcome to our second League of Women Voters Davis Area Health Forum. My name is Michelle Famula and I'll be the host for this moderated discussion titled Healthcare Reform, Demystifying Future Healthcare Options. This forum is being recorded and streamed on YouTube Live. Our League Healthcare Committee has invited the speakers and developed the format and moderated questions for tonight's forum. Our webinar host will receive your audience questions throughout the discussion. Please submit your questions directly to the host using the chat function at the bottom of your Zoom screen. A timekeeper will advise speakers of their time. Tonight's presentation is not a debate, but rather a 1-hour facilitated discussion to help voters better understand healthcare reform options and to compare a public option proposal with a universal care single-payer system in time to better appreciate November 2020 candidate healthcare positions in debates and forums. Tonight, two nationally recognized experts, Jodi Reid, Executive Director of California Alliance for Retired Americans, and Anthony Wright, Executive Director of Health Access California, will better acquaint us with the provisions of a public option expansion of the ACA, including some of its most popular variants and options, expansion of Medicare eligibility and Medicaid enrollment by choice, and a universal care single-payer health reform proposal, sometimes called Medicare for All or Healthcare for All, including provisions for public funding and elimination of private health insurance. The discussion format will begin with speaker introductions, followed by 4 moderated questions that our speakers have been given in advance. Each speaker will have approximately 3 minutes to respond to the question, and then each will have 2 minutes for a follow-up response. Each speaker will then be offered a second opportunity of a 1-minute comment, and if there are no further comments, we'll move on to the next question. We'll try and hold each discussion question to about 12 minutes. Following this moderated question portion, we'll ask our speakers to respond to your audience questions. In conclusion, we will ask each speaker to provide a 2-minute closing statement on how voters can improve their understanding and what they can do to address their health policy concerns. We begin now with speaker introductions from each of our speakers this evening, and we begin with Anthony.
Is this my, do I just introduce myself or is this an opening statement?
Yes, I'm sorry, Anthony. Yes, we will ask our speakers now to introduce themselves. First Anthony and then Jody. So we begin with Anthony. If you could just give us a minute to introduce yourself.
Yes, great. Thank you. My name is Anthony Wright. I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition, working for the goal of quality, affordable healthcare for all Californians for over 30 years. We're proud to be a coalition organization that includes great organizations representing different constituencies, including CARA, the great organization led by Jodi Reid. And we have fought for both the vision of a universal healthcare system, including single payer and Medicare for all, and also for the battles of the moment, whether it's fighting for the ACA, for Medicaid expansion, and variety of consumer protections and other issues. I'm proud to be a resident of Davis. I'm on the Yolo County Library Advisory Board, and so happy to be part of this event with the League of Women Voters of Davis.
Thank you. Jody?
Hi, everyone. I'm Jody Reid. I'm the Executive Director of the California Alliance for Retired Americans, otherwise known as CARA. It's a lot easier to say. We are a statewide grassroots senior advocacy organization. We're also a coalition of about now 300 organizations that represent seniors and senior issues, from labor retiree organizations to senior housing, resident associations, mobile home communities, senior serving agencies. And we try to come together to focus on issues of concern to seniors and their families. Our primary focus is state legislation and state advocacy, but we are part of a national network of Alliance for Retired Americans organizations. There's 38 states that have a similar organization to ours. We're all very separate, but we come together through our national organization called the Alliance for Retired Americans on national issues like Medicare and Social Security and Medicaid and the Older Americans Act.
Thank you. So we begin this evening's discussion with the first question. I'll ask Jody to respond. Please review the challenges for consumers and care providers under our current healthcare system of the ACA, Medicare, Medicaid, and private insurance as you understand them.
Okay. So in our current system, and I work with people who are primarily on Medicare and Medicaid, and there is a huge misconception in California and in this country that if you have Medicare, you've got it all, and that we all ascribe to someday turn 65 and have Medicare. But the truth of the matter is that Medicare only covers hospitalization basically and some outpatient expenses. And everyone needs to then have some supplemental insurance that is now privately provided, with the exception of those who are low enough income who qualify for Medicaid, or in California, Medi-Cal. They're called dual eligibles or Medi-Medis, and their supplemental coverage is through Medi-Cal. And so even though many people thought that seniors weren't going to be that impacted by the ACA, the truth is that our supplemental coverage is provided by the private insurance industry, just like people who are not yet on Medicare and have to get their health insurance through the various private plans that are offered. Unless, of course, they're eligible for Medi-Cal, and even most Medi-Cal recipients are assigned to a private managed care environment to receive their care. With that comes all kinds of challenges that the ACA includes, Medicare includes, that there are things you have to stay within network. So you have to go to the providers that are part of the network that your insurance is in. You have certain formularies for services and for prescription drugs that are determined by that network that you're in. The costs are not really regulated. They're supposed to be, but you know, it's really market driven. And even with the best plans, there are still out-of-pocket costs. And for many people whose healthcare is connected to their employment, when they no longer have employment, they no longer have healthcare. And we have, in this era of COVID, have seen millions more people lose access to their healthcare during a time of a pandemic, when we all should be comfortable with the fact that if we need care, we'll have access to it and not go bankrupt because of the costs associated with it. And even people who are covered by insurance or supplemental insurance still have out-of-pocket costs that sometimes are so exorbitant that they don't seek the care when they feel they need it because they can't absorb the cost. So in our very private insurance, private organized healthcare system, it leaves millions of people in California and our country out. And now with COVID and the loss of jobs, millions more are without insurance. It's a very broken system that is based on what the insurance companies want to provide and not based on the healthcare that we need. It is not person-centered. It does not cover many of our body parts that need health just as much as the other body parts. For Medicare, dental, vision, hearing, podiatry, and especially long-term care are not covered benefits. It's hugely important for the populations I work with, but for everybody, because we're one person, we're not body parts. And so we have a lot to do to fix the system, to control costs, and to make sure everybody has access to one standard comprehensive benefit package at a cost that they can afford.
Thank you. Anthony, really
Yeah.
same question, challenges for consumers and care providers under the current system.
I mean, I would agree with much of what Jody says. I think that our healthcare system is fragmented, is confusing and complex, and almost Kafka-esque in how consumers have to experience it and should try to deal with it. leaves significant gaps. Let me break it down in a couple of different ways and also suggest ways that we've actually have seen the potential for progress as well as the peril of going backwards in, the issue of access, affordability, cost and quality. On access, we have a system that leaves a lot of people out. Half of us get coverage through employers, about a third through public programs, and then the rest of us have to buy it as individuals. And in California, we had as many as 7 million uninsured, nearly 20% of the state. The Affordable Care Act actually showed that we can make progress in this regard. We actually had the biggest drop of all 50 states, going from 7 million down to about 3 million, by both bolstering employer-based coverage, expanding public programs, and then basically totally redoing how people buy coverage as individuals, as sort of, for those people who fall through the cracks of those two systems. But that still leaves, 3 million, around less than 10% of our state uninsured, which means that they live sicker, they die younger, they're one emergency away from financial ruin. And of course, that doesn't include the millions more who are underinsured and find themselves facing the out-of-pocket costs that Jody was talking about. And the high cost of healthcare is something that's very significant for people who are paying out of pocket, but for any of us who are paying premiums. And we have a healthcare system, unlike any place in the world, where the prices that the healthcare industry charges is basically what they can charge, rather than either negotiated or set by the public, by the government. And so that's something that we need to address going forward. And then finally, just this issue of quality, that at the end of the day, we want a system that actually is focused on the patients rather than profits, that is focused on public health. And so we want to make sure that their incentives are aligned so that, people do best when they are actually providing primary and preventive care, providing, keeping people healthy rather than just taking care of them when they're sick. And right now, that's not where the systems are aligned. The systems are aligned where if you grow bigger, you can charge more, and that costs all of us either as out-of-pockets in our co-pays or deductibles or in our premiums. So in my last 30 seconds, I will say, the debate in DC is unfortunately, we can't talk about the status quo without talking about the threat of going backwards. And right now we are in a cataclysmic debate at the federal level about whether we even make the progress that the good but incomplete progress that we have made over the last 10 years, and we undo it and blow that up and throw chaos in the healthcare system by repealing the Affordable Care Act. And that's something that is very much in the debate this year, especially now with the debate around the new Supreme Court justice, since the very constitutionality of the question of whether the Affordable Care Act will be struck down in its entirety is going in front of the Supreme Court literally the week after the election. And so we have I know we're going to get into the debate about what's the path to move forward, but I want to make sure that people recognize that we could lose even the progress that we've made depending on how voters decide this, in the next month.
Thank you. So I'd like to give each of you an opportunity, if you would like, in a follow-up statement. I know that you had a chance to speak, Anthony, after Jody had first spoken, and then I'd like to give Jody a chance just to respond. But if either one of you might pay a little bit of your answer to the challenges for care providers as you see them. We spoke a lot about consumers. Do you have any thoughts about challenges to care providers?
Well, certainly in this moment, the concerns are monumental. The fact that we were unable or maybe unwilling, I don't know, depending on your perspective, to provide the necessary PPE for our frontline healthcare workers who are dealing with this pandemic is front and center in my mind. And it's still a challenge, not as much in acute care settings now, but certainly in skilled nursing facilities and rehab facilities where many people wind up going to recover from acute care procedures. The record on providing PPE is dismal. The pay and staffing levels at some of these clinics and facilities is horrendous. And so we have people, especially during an emergency situation like this, who are working incredibly long hours, not having the kind of protections that they need. Staffing standards is something we fought for and won, and for nurses anyway, in California, but that is not reflected across the country, and certainly not in other kinds of healthcare settings. Hospitals barely do it. So I feel like we need to do a lot more to protect our workforce, but also we have a huge workforce challenge ahead of us. I mean, I work with seniors, and we are the fastest growing part of California's population for sure, and that's true in other states as well. But we're just not ready for this continuing boom, and so we have we don't have the caregivers, we don't have the people who can come into folks' homes. One, because it's not covered by most insurance, and two, we just haven't trained the workforce to deal with some of the issues that, as we age or maybe become disabled, that is required. So we need more primary care physicians, we need more nurses, we need more nurse assistants, we need more social workers, we need more pharmacists, we need a lot more of every kind of healthcare provider. And if we really want to go towards a system where we have access to care for everyone, that is going to be compounded. But maybe we can move some of the people who are insurance claim adjusters and salespeople into retraining them for a more direct hands-on healthcare position. But that's a huge challenge, and I think one that is becoming clearer and clearer every day.
Thank you. Anthony, thoughts about that?
I mean, I think the question about providers, I do think, again, we have a system that is focused on profit rather than on public health and prevention and everything else. And so when if decisions about spending, decisions about resources are focused on market aspects, when the market changes, like it did with the shelter-in-place order, then we're not prepared. We're not, and I think that's a real problem. The fact is that we had many providers, because of the shelter-in-place, who lost a lot of revenue because people weren't going to their doctor. And I think it raises the question, we don't pay firefighters per fire. We don't pay librarians per book checked out, but for many, doctors and healthcare providers, we pay them per visit, per procedure, or per patient, which is not, and I think one of the reasons why I and others support a single payer system is at least it gives us the tools about how do we actually pay both a fair amount, not one that's too low, as Jody was talking about, but also not too high, but also one that would actually incentive better quality, better outcomes, reduced inequalities, etc. How do we have more global budgets that both are mindful of cost containment, but also focused on keeping a whole community healthy? And I think that's something that we can do.
And I just want to say one other thing. Can I just add to what
Oh, absolutely.
Even before COVID, Anthony's absolutely right. A lot of providers are not getting income because we're sheltering in place and services have really changed. Everything's gone to telehealth, and I'm not even sure how you reimburse for that. But even before COVID, there's been a real growing challenge for healthcare providers who have had to, in their small associations or networks or PPOs, have had to pay, this is especially in primary care, pay for enormous administrative costs because everybody comes in or many people come in with different kinds of coverage. Even within the same health plan, you can have like the platinum version and the gold version, and what that covers and how much it pays is a administrative and billing nightmare. And so many physicians and their offices spend as much time or too much time fighting with the insurance companies, filling out forms, instead of providing care. And it has become, you know, I've heard stories after stories. I noticed that Hank Abrams and some folks from Physicians for National Health Plan are on in the chat. And, you know, I've heard from many physicians that I know who have just have left and retired from being especially a primary care provider, because it's just, they're not doing the work of being a doctor. They're doing the work of being a bureaucrat and a paper pusher in many ways, and not being able to prescribe a treatment plan, a medication plan that makes sense to them and to to the patient as a partnership, but based on what the insurance company will pay for. It takes, you know, people didn't study and pay all that money to go to medical school and then be told what they can and cannot do by a company that really doesn't know anything about healthcare provision, but is looking at the bottom line.
So I really appreciate how the two of you have kind of set the stage with the answer to this first question. And so we're going to go into the second question. We'll start with Anthony, and that is, will you please share your vision for the path forward to a successful healthcare system that is patient-centered, accessible, and equitable for all persons needing care in our community? We ask that you address how the public option ACA expansion and the single-payer universal healthcare proposals would each seek to achieve this goal.
So, I mean, I would say that I think there is a vision of let's get to a universal, unified healthcare system, often called a single-payer system, often called Medicare for All. That my organization supports that. I support that. So both my organization and I have supported that for over 30 years in terms of how to get to that vision of a unified healthcare system. I think I think that there is a debate that happened in both the Democratic primaries of, you know, in the presidential debate and others about what is the path forward to get from here to there. And does that require some steps along the way, building on the progress that we have made under things like the Affordable Care Act, where we have proven that progress is possible, sort of trying to address some of the voters' justifiable cynicism about whether anything is doable, whether progress is even possible. I think we have shown that, in fact, we can make real strides and help millions of people with new consumer protections, new oversight over parts of the industry, new coverage options that people have. But also then how do you take those additional steps forward? And so I do think that, for example, if President Biden were to be elected and a Congress that was willing, they would be able to do a number of things to both build upon the Affordable Care Act. Some of those are, you know, basically fixes and improvements on the existing systems, further expanding Medi-Cal, improving the affordability assistance in exchanges like Covered California, putting in place greater consumer protection, like that, against whether it's surprise medical billing, directly addressing the issue of prescription drug negotiation, both in Medicare and other programs to get better prices for prescription drugs, those types of issues. And then there's another set of even more ambitious proposals that are called sort of and there's a lot of things that are called the public option proposals, but some of those include everything from taking the Medicare program that exists and lowering the eligibility age from 65 to 60 or 55 or 50. That is one of the things that's in the sort of Biden-Sanders agreement, common a unity pact that they negotiated. a public option that people, that no matter who you are, you can choose to go into to that. And that could be a mechanism by which we do set some rates that are fair for providers, but that don't price gouge us in a specific way, and actually try to get more public acceptance with the notion of the boogeyman of government-run healthcare, which is one of the arguments that have been used against the notion of a single-payer Medicare for all system. I do think that at the end of the day, we can get to that goal of a fully universal healthcare system. Every other industrialized country in the world does it. Every industrialized country does it in a different way, and you know, whether it's Canada, Britain, Germany, Switzerland, you name it, they're different. And America's is going to be American and a little bit different too. But it is. But I do think that the goals of having a system that is unified, that where we pay through our taxes based on how much we can afford rather than how sick we are or how old we are, is a really important principle of something that's progressive, something that's universal, that everybody's included, because our system is stronger when everybody's included, something where the government actually negotiates or sets the prices, something where, again, the focus is on prevention and public health rather than profit. And I think we can make real progress toward that goal while also having the vision of how do we get there. The last thing I'll say is that here at the state of California, we're trying to do that and take both of these efforts, these complementary efforts at the same time. I'm in the legislature, I'm very much advocating against budget cuts and for these expansions and for these efforts. At the same time, I'm proud to be on this Healthy California for All Commission that is actively trying to figure out what is the path, what is the plan of what we're trying to get to, and what's the path to get there in terms of what kind of federal waivers and approvals do we need, what kind of financing do we need, what kind of, to figure out all the sort of details that you need to do to be able to take the step when that window of opportunity opens, whether it's in 2 months or 2 years, to really develop that plan. So I'm, excited to do that. Obviously, the COVID crisis has made it both more urgent, but also less time and focus by the people who are the policymakers to focus on this. And so we are continuing to push to try to move as far ahead as possible, especially with maybe the opportunity that might arise at the federal level. Thank you.
Thank you. Jody, would you share your vision for the pathway forward to a successful healthcare system for our communities?
Yes. So I do not think that a public option is a step forward. I think, there's a lot of different definitions of it, but so this is my limited view of what that means. I think it is seen as a way to drive down costs by offering competition to private insurers, but not having the expense of having the administrative costs, the marketing costs, the high executive salary costs that private insurance companies have, and so that it can compete. But the problem with that is that part of the reason, so people who would be able to enter and purchase into this public option and choose that, unfortunately, are going to be the people who don't have access to any other kind of coverage through their employer, they're not Medicare eligible, they're not Medi-Cal eligible, and so their income and their way in is going to be lower. And because that's the status, their built up health issues may be larger. And so the beauty of Medicare, and the reason why the Medicare for All model is one that we promote, is because everybody's in. It is age specific and ability, disability specific, but everybody's in, all putting their money into this one system. And so in a public option, the risk pool becomes, and the people who enter it become those who are less financially wealthy and also have health, they can't get health care anywhere else because they don't have access to it and can't afford it. And so it's not a model that a Medicare for all model would be. The healthier people are contributing in the same as the people who need health care at this moment. And we're all in it together. We're subsidizing each other. That doesn't work in a public option. And so what will wind up happening is the very same problems that happen in a private insurance environment, where the public option managers are going to have to really think about what kind of services can they afford to provide to this population and what will they have to deny. And they're going to be in the same boat as the private insurance companies because they're going to have a very less robust pool with which to work. To me, if we have a change in leadership this November, I think the opportunity is to take advantage of some of the provisions in the ACA, which allow initially for state implementation, state examples, and to fight for the right to get the waivers so that California can bring the federal dollars it pays into our state to create the first Medicare for all single payer. I think we need a better, Medicare for all is not a term that people on Medicare embrace because Medicare has a lot of weaknesses. It doesn't cover all the things that we would want to cover. So we often say improved and expanded Medicare for all because people don't necessarily know what single payer means. And that's really the financing mechanism, not the care, the overall kind of care and benefit package that we're talking about. Nonetheless, Ro Khanna has a bill that would kind of set the path for how states could apply for waivers and implement a waiver. California is bigger than Canada. It's the 5th biggest economy in the world. We spend over $380 billion a year already on public programs, on Medi-Cal and Medi-Cal expansion, on covering people who are employed by the state. We the taxpayers already spend close to all the money we would need to transition. And what a waiver would allow us to do is to bring the other federal dollars that we Californians pay into for Medicare while we're working. And when we're on Medicare, there's still a payment comes out of your Social Security or you pay it directly. Bring those dollars into California so that we can then expand the pot and be able to provide a standard benefit package for everyone that includes the ability, as Anthony said, to negotiate prices both for medicine, for prescription drugs, but also for procedures, and to develop these global budgets for hospitals, for providers, so that people know what to expect as a provider of care, as well as for a patient of care, and to be able to move to a system that is patient-centered, that allows the patient to work with whichever provider they choose on a plan forward for their best health.
Thank you. Anthony, do you have a response with that?
Yeah, I would agree that there are versions of the public option that, or frankly, any of these reforms that can not work or be steps backward, but there are versions of it, that to address some of the issues that Jody raised that actually, I think, are in fact building the infrastructure, both the policy and the political infrastructure that get us closer to the goal of a universal single payer type healthcare system. I think that, the model of a public option could be very much like the model of Medicare now. You have private plans in Medicare now called Medicare Advantage, and then Medicare is sort of the base public option, and then there's these other options that people have, and that they can do to supplement. I would want there to be more equality between the systems. I wouldn't want to replicate some of the problems of our existing Medicare system, but I'm just simply saying that, we do have working models about how this works now. I would say, in terms of, in some cases, the whether it's public option or some of these other issues, the question is, how do we sort of address the issues of how do you get to a universal single payer healthcare system and And to the extent that there are obstacles, let's take them seriously. If you take single payer seriously, you need to take the obstacles to it seriously, and not as an excuse for inaction, to be very clear, but in order, how do you take those obstacles seriously so that we can get around them? And, you know, some of the obstacles are obvious. You know, the ideological opposition that, you know, that we saw against the Affordable Care Act, the industry opposition, and not just from insurers, but especially from providers who frankly don't want any public system, whether it's a public option or a Medicare expansion or Medicare for all, because they are concerned that means that that what Medicare for all means to them is Medicare rates for all, which they don't want. They don't want that sort of government price setting, government negotiation piece of that. So doctors and hospitals, at least the organized lobbies for those groups, are opposed, and they're opposed to the public option as much as they are to you know, the broader reforms. And then, you know, Jody mentioned the issue of financing. How do we, you know, here in California, we have a $400 billion healthcare system. And I absolutely agree that if we were to finance it through a tax-based system, make it more efficient, we could actually save the overall system money, but we still need to collect the dollars, and about $250 billion comes from the federal government. Then there's another $150 billion that is collected through premiums and co-pays and deductibles. And so we're going to have to figure out both how do we raise the $150 billion if we're not going to be charging private premiums and deductibles and co-pays, you know, so what do we do in terms of taxes? And then how do we raise the how do we get the $250 billion that we get from the federal government? And again, what, you know, waivers and congressional approvals, both administrative and the federal approvals, we need to get there. But I think the biggest obstacle, and this is why there is a conversation about public option. And so I'm fine if people, you know, don't think it's a right move. And frankly, you know, depending on the proposal, I can be pretty ambivalent about some of them. But I want to be clear about why it's there, which is that I think the biggest thing that people have acknowledged about why there is an obstacle and why when single payer has gone to a ballot, you know, it has not fared well in Oregon, Colorado, and California over the years. It's because of what people call loss aversion, that we're basically telling people if you people really value the coverage they have. Health coverage is really important for them and their family. And to tell people, okay, we're going to take what you have now, we're going to replace it with something better that the government will provide, trust us. That's sometimes a hard sell. There's real skepticism there. People value loss more than they value gain, even if what they're going to get back is better. And so it's much easier. So I think the notion of the public option concept is there a way that we can offer people something where we can offer them the option, and then people will walk with their feet to a program that provides better benefits and can do it cheaper. And I think that's the concept. I think that there are real reasons in the implementation to make sure it's done right. But I do think that, you know, in the Sanders-Biden unity proposal, there was an attempt to try to create something that was expansive enough, that was dominant enough in the market to be able to be to not be just an add-on to the market, but to be a price setter in the market. To get to the goal and get us that much closer to the end goal. So that's the argument.
Thank you. I appreciate that. In the interest of time here, because I think you have addressed in your answers, both of you, the questions about what current federal legislative proposals are out there and what California state level leaders should be doing. I'm going to give each of you an opportunity to maybe speak to that for a minute or two about what you see as going on in the legislatures, either federally or at the state level, that voters should be paying attention to, that suggest ways of dealing with these challenges or propose new pathways. Actually, Anthony, you're the next one to start first. I know you just spoke. Could you respond to that one?
I mean, I actually want to, I mean, if we're going to talk about the federal debate, then we actually have to take a step back. That, you know, I think the the friendly debate about strategy that I have with my colleague of many years, Jody here, and with some of the people in the chat who I have known over many years, and the friendly debate about, can you take sequential steps to single payer? Does it all need to be in one leap? I think that I'm happy to have that debate. I believe that these efforts are complementary, both the vision of getting the single payer and the steps to get there, whether it's expanding Medicaid to the undocumented immigrants, or whether it's creating new patient protections in the healthcare system, et cetera. I'm happy to make the case there. But if we're talking about the federal debate, we have to acknowledge that that the debate we're having, that we just had in the last 10 minutes, is happening on one side of the spectrum, and there's another side of the spectrum, which is about going backwards, which is about blowing up the Affordable Care Act and losing the coverage and basically taking away coverage from over 20 million Americans, including over 4 to 5 million here in California. Losing the Medicaid expansion, which covers 3 to 4 million Californians, losing the help that people are getting to afford coverage for over 1 million Californians, losing the protections for people with pre-existing conditions and allowing the insurers to once again deny people or discriminate or charge them more based on their health status, losing, blowing back up the donut hole in the Medicare benefit, and I can keep going on and on and on. And that is something that, again, the Trump administration and the state of Texas is trying to, is literally arguing in front of the Supreme Court the week after the election that, because it's a fairly ridiculous legal argument, but their ultimate conclusion is that the entirety of the Affordable Care Act should be struck down. And so I would be remiss in front of election to do that. If we do have a new president and a Congress willing to work, I think they can sort of pass some legislative remedies to void that Supreme Court decision. Obviously, there's a whole debate about the judiciary that also needs to be dealt with, and also then that takes the steps forward that could get us both sort of short-term relief, like increased affordability assistance and dealing with prescription drug costs, as well as sort of the broader visions, including what was in that Sanders-Biden unity document.
Thank you. And Jody, would you like to make a comment on how you see federal legislative or state legislative opportunities to address our challenges or pathways forward?
Yes. Everything that Anthony said about at the federal level and the challenges we face are real, and we have to vote. And we have to vote like our life depends upon it, because literally it does. Whether we're talking about COVID or access to healthcare or on so many levels, this is the vote of my lifetime, and I think of most of us who are on this call. And to the extent that, California is a blue state, but, we've got congressional races here that will make a difference. We want to hold on to the races, the seats that we were able to win, and add to them. So we have a role to play there as well as in the presidential, but we can also be helping, and I know many of you are, making phone calls and writing postcards, et cetera, to people in swing states that really need to hear from us, because it's not just who the president is. We also need to have a Congress that is willing to take the steps necessary, whether it be passing the Ro Khanna bill that I mentioned, or a bill to negotiate for drug prices, or whatever. We need the Senate and the House to support that effort and not stymie it. And so the election is pivotal. But because I don't want to sound sometimes hopeless about this, I also think that we're at another pivotal moment in our country's history, not just with COVID, but with all of the organizing and leadership that's coming up through the Black Lives Matter movement and through efforts for social and racial justice. And if you look at who's been impacted the most by COVID, who's impacted the most by health disparities and lack of access to healthcare, it's the growing majority of our country, which right now are those populations and communities of color. And they are rising up and need to take the lead on demanding economic justice, healthcare justice, housing justice, racial justice. And that, I think, is a movement that isn't going to be quelched. And even if the worst happens in Washington, that movement is going to continue. And I think we need to do everything we can to support that effort and to make sure that healthcare justice is a part of that conversation. And there's no place more important for that to happen than California. Our demographics are completely being flipped on their heads. And the majority population in our state are communities of color right now, and who have suffered because of our broken systems and our economic inequality. And so we need to join forces with that movement. And the only way we're going to get our elected officials to implement a single payer Medicare for all system in California or nationally is if we make them do it. We have to make them do it. We have to show them that their political livelihood, if you will, is dependent on moving this forward, because that's what their constituents are demanding. So we have an opportunity with this increasing organizing and sort of movement building that's happening right around us right now. We need to be part of that. We need to support that. We need to make sure these issues are at the front and center of that. And we need to push our elected officials in California and ultimately nationally to respond to the reality of our society right now. And I think I have a lot of hope in that. You know, it came out of some really horrendous, terrifying, hideous incidents, but the movement is strong, and I think it gives me a lot of hope.
Thank you. I think you've both given us and our audience a lot to think about this evening, and I really thank you for your comprehensive answers to these questions. And a lot of them are very clarifying and actually covered many of what the audience had submitted as questions as well. So I'm going to select a couple of the audience questions and ask if you can give a 1 or 2 minute response to those, some of which are a little different than what we have talked about right now. The first question is, with the ever increasing numbers of Californians losing not only their jobs, but also their health insurance, as you pointed out earlier, Jody, what do you recommend the governor and legislators do that is economically feasible and equitable? And I'll ask either of you to answer this first, and then one of you to answer it second. You want to start with that, Anthony?
I mean, you know, I think this is the first stress test of the Affordable Care Act as a safety net in an economic downturn. We, you know, since unlike, as opposed to the opponents of the ACA who thought it would bring economic ruin, we had actually 10 years of economic growth since its passage. And so this is the first time that it is serving as a safety net. You know, Medicaid, which is now much more broadly expanded, is now a safety net for the rest of us, covering California as well. But there needs to be more help. So I'm very proud that, you know, Health Access co-chairs the Health for All campaign, allied with the California Immigrant Policy Center and many in the immigrant rights movement, to try to expand Medicaid to be inclusive of all, regardless of immigration status. And we were able here in California to win coverage expansions for all income eligible children and then young adults, regardless of immigration status. We were this close to winning for seniors, but unfortunately the budget deficit that came along with the COVID-19 crisis forestalled that, and we're gonna continue to fight for that. I think we're going to continue to fight for additional affordability assistance so that people have lost their employer-based coverage, that they do have an ability to not have sticker shock when they are trying to buy coverage by themselves. I do think that that's work that we need to do. That's immediate stuff that you know needs to be done yesterday. But I also think that I also just want to be responsive to some of the questions I see in the chat of just. I do think that we also need to move forward on the planning of, especially of what kind of waivers and approvals we may need at the federal government. I was disappointed when the commission that I'm on was suspended. They say that they're going to engage us as no later than February. And I think a part of that is because some of the key principles in the Newsom administration are just so taken up by the emergencies of COVID-19. And I understand their argument is that they have to put, they're literally, not just figuratively, but literally putting out fires. And so planning for the next house is a little bit hard when you're still putting out just fires. But I also think that we do have this huge opportunity with a new administration, and we want to get in as quickly as possible to sort of put in those requests, because some of the stuff that we want to do at the state level really does require at least an engagement with the federal government, if not waivers or legislation or act of Congress. And some of that work takes some time. So we want to get with it.
So Jody, same question. What would you see as a first line response from the governor and the legislators to deal with the number of Californians that have now lost their health insurance due to COVID?
Well, obviously, I agree that we need to be focused on maintaining coverage for everybody who has it and expanding access to those who don't or who have lost it. But everything with the goal in mind of moving towards what I see as a Medicare for all system. And so the first step is the budget. We're going to start our next legislative session with a proposed budget by the governor that's going to be probably fairly dismal given the recession. And so, fighting to make sure that the programs that exist remain, and that we look for new options to cover those who have lost coverage, and that can build into a single payer system. So there were some really progressive proposals that came up at the end of the year. They didn't make it through the legislature, and Health Access and CARA and many other organizations were part of a coalition called Commit to Equity that had a couple of different proposals. One was a millionaire's tax that pay a higher income tax when you're a 1 millionaire, 2 millionaire, 3 millionaire. And another, which I think is a really brilliant idea, is a wealth tax that actually taxes on your total wealth, not just on your income. So your yachts and your property and your investments, and not just on how much you make. Both of these could generate billions of dollars, and those dollars should be spent to make sure people who don't have access to coverage get it. And so those are proposals that I feel like need to be part of the conversation in California as we move towards getting this commission reinstated, getting potentially legislation, getting the governor, if we have a new president and a new administration, the very first thing we should do on November 4th is get the governor to write a letter to the president requesting a waiver to bring California the dollars and the federal dollars that could help us build the system that we need to cover everybody. So I feel like, what we do in Washington, it will be dependent on the election. But what we do in California, some of it isn't dependent on the election. We have the power to do some of this in California with our governor and our state leadership regardless of what happens with Washington. It will be more limited depending on who wins, but there are some things we need to do. We had to fight to keep some basic programs in our budget during this budget session that were programs that kept people out of nursing homes, out of hospitals, with access to healthcare, because the governor originally proposed cuts that were hideous. And together we fought to do our best to maintain those, and we're going to have to fight again come January when the new budget is presented. And we need to offer revenue options that are fair and progressive, like a wealth tax and a millionaire's tax. And so I think we need to be united around doing that with all of the other organizations that are working for economic and social justice.
Thank you. I think we are getting close to the end of our hour. I know many people submitted questions. I hope that they feel that in the course of this time, since so much information was exchanged, that the main thrust of their questions were responded to. I've been looking over the questions over and over again to see if there was something in there that maybe you hadn't addressed. Maybe it won't be as completely as those folks had hoped for. We will be having more forums, and we welcome the opportunity for more questions. But I want to thank you both, because I think that your answers have been very comprehensive. You've really devoted yourselves to informing the audience and expanding upon the topics that have been raised. I would ask now at the end here that each of you, if you could provide a closing statement. We've sort of been asked to ask you this in your closing statement. Can you tell us what you would counsel voters to listen for or to pay the most attention to as they're weighing the healthcare positions of our candidates in November? And are there any actions our voters can be taking to now address their healthcare policy concerns? And we'll begin with Jodi.
Oh boy, well, certainly I would be asking candidates at every level, local, state, and federal, how they see addressing the healthcare disparities that are facing our communities and our state and our country, and what proposals they would be supporting at the national level. There's also a ballot measure right now, Prop 15, that I want to plug. I know the League supports this, but at this time when we are struggling with revenue at every level because of COVID and the recession that it's brought, we have an opportunity for the first time in 41 years to pass a proposition that would require big commercial properties and industrial properties to pay their fair share in property taxes. It would bring $12 billion into our state. That goes directly to schools and to local community services. And this is an opportunity at the local level. It's not state money, it's local money, but it gives us an opportunity in Davis and in every community to really work with our local officials to talk about how are we going to provide access to care during this very difficult and challenging budgetary time. It's in front of us. You're going to get your ballots next week. Vote yes on Prop 15. It's a lot of money to every community, and it's been wrong that we haven't regularly reassessed these properties. Every other state in the country does, except us, and it's time we rectify that. Finally, I would say that we need to, there are a lot of organizations that are focused on different aspects of dealing with our healthcare crisis. From Black Lives Matter and some of the organizations that are working for racial and economic justice, to CARA, that kind of works on this issue through the lens of people who are older and have disabilities, to Health Access, that brings coalitions that are working on healthcare together. Healthy California Now is a statewide organization that is primarily focused on single payer in California. Find a way to connect in healthcare for all. There is so much work to be done, so much education still to be done, so much conversation to be had, and there's lots of opportunities to do that, and find your way into one of those that makes sense for you, and start raising these issues. And we need to start finding our strategy forward and to unite wherever we can, because together we are much more powerful than if we're all fighting separately on different issues. So looking for ways that we can come together on those things that we agree upon and then do it. The election is just one day and it's the beginning, but the work is really about the organizing that we all do together. And I hope you'll all join us as we continue to fight for healthcare for all.
Thank you. And Anthony, your advice to voters as to what to listen for and to pay attention to and what they can do now to address their healthcare policy concerns.
I mean, I think Jodi had an excellent and summary, so and took many of my points. So I'll just maybe say them a couple of ways. I mean, one is obviously vote up and down the ballot. Everything matters. I do think that when you're talking about healthcare, you're talking about money, and so to the extent that especially in a moment of COVID, especially in a moment of economic distress, one of the problems with healthcare is that it's counter-cyclical. The demand is greatest at the time when we have the least of it. And so we are facing, as Jody said, some significant things. We were proud to work with CARA and many other groups to try to fight some of the horrific proposed cuts, especially to senior health care that was proposed, and we're going to need that again. And so we need to work on revenues, both and raising taxes, including that means raising taxes where the money is, and that means some of the wealthier and upper income. That also means on the ballot on corporations that have gotten sort of unfair tax breaks over the years, and that's what Prop 15 does, and that would provide a infusion of dollars to count. So I just want to underline that support for that. I do also think that as moving forward into the new world, the federal stuff will always matter. We can raise a lot of money in California, but the scale of what we get from the federal government is just mind-boggling. Whether in the context of like financing a whole universal system, I mentioned $250 billion, but even the striking down of the Affordable Care Act. If they strike down the Affordable Care Act, just from a dollar's point of view, not in terms of the millions of people who would lose coverage, but just from a dollar's point of view, that's $20 billion lost from the Medicaid expansion and $7 billion lost from the subsidies in Covered California. $27 billion is the equivalent to what California spends on all of higher education, UC, CSUs, including UC Davis, and all of prisons combined. It's not the kind of money that we can make up easily. And so that's why we need to fight at the federal level. And then we also need to keep, and then the last thing I'll say is that we need to keep our local elected officials about holding the health industry accountable, because they're also with some of the folks who take some of the money from our healthcare system, and we need to hold them in check. And we have two members here in Davis, in Aguilar Curry and in Assemblywoman Aguilar Curry and in Senator Bill Dodd, who sometimes are the swing votes on some of these key issues, like bills just in the last year on having the Attorney General have greater oversight over hospital consolidation, or whether there should be greater oversight over surprise medical billing or things like that. So so even folks in a blue state like Davis, in a blue city like Davis, in a county like Yellow, have a real role to play at the federal level, but also at the state level. And so please be engaged. And I think Jody listed, and I think that there's a role for everybody. If you want to be focused on single payer, that's great. That helps the debate. If you want to be focused on a variety on the issue of health equity, or the issue of coverage expansion, or the question of covering the undocumented, there is a place for you to be in this movement. Thank you.
Can I just say one more thing? It's a resource. I didn't put it in the chat, but I wanted people to be able to see it, because I don't know how many people got a chance to, but there was an incredible program put on by Public Citizen, which is a national organization, on single payer. That was a group of panels, one led by Bernie Sanders, one led by Congresswoman Jayapal, and one led by Congresswoman Perry from Massachusetts, all who are single payer supporters and part of the, who are on the Sanders and Jayapal bills. But what was really amazing about it is the people who they brought together to talk about different aspects of the fight. It's recorded, and if you go to Public Citizen and look for Healthcare Town Hall, you can watch it. And a lot of things we didn't get to today about financing and about equity and about coverage were talked about there in really powerful ways. And I urge people to take a look at that, because it fills in some of the blanks that we didn't get to today.
And we'll be happy to put that link on the follow-up information from this forum this evening. Thank you so much for mentioning that. So this concludes this evening's healthcare forum. This forum has been recorded, and so it can be viewed at our League of Women Voters Davis Area website, which is lwvdavisarea.org. We'd like to thank once again our speakers, Anthony Wright and Jody Reid, for guiding us to better understanding this evening Thank you so much for this rich discussion. Thank you so much for your earnest invitation for voter engagement right along with the League of Women Voters. This is exactly what we want to hear. Inspire engagement, inspire voting. We thank our audience for your interest and participation. We greatly appreciate the opportunity the League has provided to our committee to present these forums. And we're actively working now to provide a third forum focused on California health reform in November. Again, thank you to our audience. Stay safe and have a good evening. This concludes our forum.
Thank you.
Thank you.